I'm gonna jump right into things because we have quite a few people here already. So today um, we will be starting off with a little just overview for those of you who may not know what Whole Communities Whole Health is. We will do a little overview of that. And then we'll have a presentation on our cohort study, which is now launching after a couple years of planning. We're excited that it is now launching. So you'll learn more about that. And then you'll get to hear about the response plan created by our community strategy team for how we as a research study will respond to health issues that arise both at an individual level and a community level as we go through our study. And so after that, we'll have some questions and discussion time a little bit, and around 4:45 or so, we will be transitioning to a different platform. We're on Zoom now, and then we will actually leave Zoom and all migrate over to something called Gather, where it enables us to have a little avatar and walk around and interact with people. It's pretty fun. So hopefully you'll enjoy that. I'll tell you a little more about it at the end. But first, as we start off today, I would like to go ahead and start with a land acknowledgement. So I would like to acknowledge that we are meeting on the indigenous lands of Turtle Island, the ancestral name for what is now called North America. Moreover, I would like to acknowledge the Alabama Coshada, Caddo, Carrizo Comecrudo, Coahuiltecan, Comanche, Kickapoo, Lipan Apache, Tonkawa, and Isleta del Sur Pueblo, and all the American Indian and indigenous peoples and communities who have been or have become a part of these lands and territories in Texas. We celebrate and honor with gratitude the indigenous people past and present who are the original stewards of this land. We have a responsibility to acknowledge the history and ongoing violence of settlers and colonialism, and to ask how we individually and institutionally can seek to end that violence and seek new paths forward. And so you'll see there is a link where if you want to go there, you can go to that link. I'm going to put it in the chat actually. There we go. And so if you go to that link, you can actually search for wherever you're at, your location, and it will tell you who the original inhabitants of that land were. And so it's a nice way to familiarize yourself with that and to acknowledge kind of the history of our nation. And if you want to do that now, you're free to do that and put it in the chat. We're actually going to go into our check-in next. So feel free to introduce yourselves in the chat. We'd love to see who all is here. Share about your land acknowledgement. And then you can also share the answer to our check-in question, which is, what is your favorite fall celebration? So that could be a holiday, that could be your birthday if it's in the fall, whatever that is. You can share that with us too in the chat. I'll invite everyone to do that now. I'll also put that in our chat.
I guess you can't just say eating is my favorite fall celebration. That wouldn't count. It works for me year round.
If eating is part of it, by all means.
Eating with family, that's it.
Celebrational food, sure.
All right, there you go.
Awesome. And so while folks are entering theirs in the chat, I will also tell you, keep it coming in the chat there. Good job. And so then I wanted to let you know we're going to have some giveaways during our open house today. We have 4 Yeti Ramblers. They're 20-ounce capacity. They're really nice little tumblers, kind of cups there, and they're insulated. They have little slider lids so you can drink out of them. So we'll be doing 4 giveaways, 2 while we're on Zoom at the end of the presentations, and then we'll do another 2 when we transition to Gather. And so we will be doing that later. All right, so like I said, we have a packed schedule. So I'm going to stop screen sharing. Thank you. There we go. And I'm gonna introduce our first presenter. And I'll just say real quick, as we're going through the presentations, please feel free to put any questions you have in the chat, but we are gonna wait until all the presenters are done to present those questions to them. But if you're worried you might forget or something, just throw in the chat, we'll be sure to grab it from there. And then we'll have that session at the end when we can have discussion and questions and answers. So now at this time, I'd like to invite Darla Castelli, Dr. Darla Castelli, to give us an overview of Whole Communities, Whole Health and a little bit of the history behind it. Dr. Castelli is a full professor in the Department of Kinesiology and Health Education at the University of Texas at Austin. She has been working with school-aged youth in physical activity settings for 30 years, leading 5 funded physical activity interventions in schools. As a fellow of the National Academy of Kinesiology and Shape America and co-chair of Whole Communities, Whole Health, Dr. Castelli studies the effects of physical activity on cognitive and brain health in children. Dr. Castelli, please take it away.
Thank you so much, Shireen. It's wonderful to see so many people interested in the work that we are doing. To think back to the fall of 2017, and we had about 10 people around a table, and we were proposing the work that we wanted to do. And I'm so thrilled to have the opportunity to share with you the progress and what we are all about. Next slide. So what is this notion of whole communities, whole health? Can we advance the slide? Whole Communities, Whole Health brings together researchers, scholars, and community members. But first and foremost, irrespective of our titles that we have, is actually the notion that we all care. We all care about our communities. We care about the participants in our studies. We can care about one another. And so when we think about the notion of the name Whole Communities, Whole Health, it actually transcends the whole university, the whole community, and the whole child as we look at multiple elements of health. Social determinants are our focal point. What are factors within the lives of children and their families that are influential and may deter or disrupt a pathway to leading a life where families can thrive together, where families can achieve what it is that they set out to do, where they have opportunity, where there's equitable opportunities to engage in these things. To actually measure and social determinants and examine that is the strength we believe is in the intersectionality of these disciplines. Even though each one of us as scholars have a gold standard approach for measuring each one of the social determinants, the strength we believe is the coming together of our work and with community members to co-design methodologies to better understand children's health and the lives of children. And we do that through the social determinants perspective. Next slide. So what are our goals in this project? Well, ultimately, we want to better understand children's health, and we want to better understand the notion of supports and systems and needs of our families. Think back to January 2018, we engaged multiple communities and we asked them their points of pride. We also asked them things that they were concerned about. And one of the things that emerged in Del Valle as a point of pride was this notion of their neighborhood, each other, the schools and nurses in the clinic run by the School of Nursing. That was a point of pride. Some of their frustration is that they were unincorporated. They didn't have a centralized government. They didn't know who to turn to in a time of need. So by flipping our scientific model and engaging the community first, opposed to designing an intervention at the university in isolation and then thrusting it upon the community, we seek to better understand children's health. We engage families who have been traditionally excluded from research, vulnerable populations. We also welcome the participation of community partners. We have a community strategies team who you're going to hear more about in just a minute, who has helped us refine our methodology, who have helped us to seek and understand the family context, the culture. We also are moving towards an equity-centered approach. And in that equity-centered approach, we're not quite there yet, but we understand and acknowledge our own biases in that work. This slide here just explains the time periods and the trajectory which we have worked on, engaging the context, engaging community partners, working with those partners, and there's that intersectionality there of sharing our resources, and then ultimately conducting research together. Next slide. Our focal point was that portion there where it is that we are in that sweet spot right now where we have launched with our ambassador families, and we are actually beginning to collect data. And I just wanted to highlight a few key things that we have done with our community partners, and I'm going to hand it back to Shireen once I do so. So with our community strategy team, we have engaged the community through vaccine clinics. We have also provided care packages to family during COVID. Pandemic could have completely shut down this initiative, and instead it inspired us to think differently about how we conduct research with communities. These are pictured here are PE toolkits that went home during the pandemic when children were isolated in their home and had to do remote education. We also will hear more eventually about water and air quality and the importance of that for families to thrive, and how we have scholars among us who are examining those things. We are rolling out right now with our ambassador families who are helping us to better understand their conceptions of health and what they need to have their family thrive. Thank you so much, Shireen, for the opportunity to introduce our entire initiative. And I'll hand it back to you so that everyone can hear more about the specifics of the cohort study.
Thank you, Dr. Castelli. Yes, it is hard to synthesize everything that Whole Communities Whole Health is into just a few minutes, but I think that was great. Thank you. So we're going to turn now to Dr. Carrie Kenny and Ms. Sarah Smith, who are going to speak about like Darla said, the Whole Communities Whole Health cohort study. So Dr. Carrie Kenny holds the L.P. Gilvin Centennial Professorship in Civil Engineering in the Department of Architectural and Environmental Engineering at UT Austin. And she's also a courtesy professor in the Department of Population Health. Dr. Kenny's cross-disciplinary research in environmental engineering and molecular biology centers on the investigation of microorganisms and contaminants in engineered systems, including buildings, residential water systems, and municipal wastewater systems. Over the last decade, her research group has explored the microorganisms, allergens, and contaminants found in schools, homes, and other buildings. These studies have led to a greater understanding of the conditions that promote fungal growth in buildings, new indoor sampling strategies, and insights into relationships between indoor exposures and health. So as you can imagine, a hot topic during the past couple of years, right? So Dr. Kinney is currently the co-chair of Whole Communities Whole Health, along with Dr. Castelli. And presenting with her today will be Sarah Smith. Sarah Smith is currently working as the research coordinator for the Whole Communities Whole Health cohort study. Sarah attended Austin College in Sherman, Texas, where she completed her bachelor's degree in public health and minored in biology and Spanish. She then went on to complete her master's degree in public health in the Department of Maternal, Child, and Family Health at the Gillings School of Global Public Health in Chapel Hill, North Carolina. Sarah has worked with a variety of research projects ranging from genetic research and cellular biology to breast cancer and HPV education to nutrition and physical activity interventions, among others. So she was very excited at the opportunity to work on a multifaceted group like Whole Communities Whole Health. So now I would love to turn it over to the two of you, Dr. Kinney and Sarah.
Thank you, Shireen. And I have let Darla down on my first coordinator position of progressing the slides. So I apologize for the slow pace of that, but I hope I caught up to you eventually. But yes, this has been a first few exciting months of work with Whole Communities Whole Health as we've launched the cohort study with ambassador families. And adding on to what we've already covered about the study and about Whole Communities Whole Health, and kind of this point where everything is coming together now in the cohort study. So what the cohort study is and what we aim to do is a longitudinal or long-term cohort study with families who have kids ages 0 to 4 years old. The families we're working with in this first year or the first phase are our ambassador families. And this is families with kids ages 0 to 9 years old, with the goal of continuous collaboration with both community members and families across all phases of the study. Oops. So this slide gives a very broad overview of the main components of the study and what families partake in over the course of 5 years. These 6 steps are intended to be our baseline data collection, beginning with the first 2 steps dedicated to meeting families and establishing what needs we can help with before any formal data collection is done. While also establishing the data collection plan that's aligned with their interests and comfort level with the measures. Steps 3 through 5 move into the data collection through a series of surveys that align with the more direct measures of health from the biological samples and research devices. We'll have the opportunity to go more into detail about those later at the tabling sessions. Oops, I'm doing very well with the slides today. The second step of the study is one I wanted to highlight. One, because of the work with the response plan and our potential point of collaboration with community partners, I wanted to highlight the second step because it's the visit where we're working with families, one, to do the consent process, which is very important for making sure the participants are aware of their rights in the study and choosing what they wish to participate in and getting all the information about what that means, as well as we do a household safety and living assessment. And from this questionnaire, we build out a care plan for the family to address short-term and long-term needs that come up. And this is the care plan intended to be made in partnership with the School of Nursing staff at the Children's Wellness Clinic, with referral plans connected to our community strategy team and community organizations that can help address immediate and longer-term needs. And then moving into, oops, our other measures that are covered in the study, kind of connecting to what Darla was mentioning earlier, is the multifaceted nature of what impacts health. And for this reason, I want to refer back to the socioeconomic framework or the socioecological model of health to show how we're connecting our measures to the level of health that they look at, as well as reiterating the message of how the measures connect across these different levels and how they can give us a bigger picture of what impacts child and family health. With the child and family health individual measures, we're looking at things such as cortisol levels that are associated with stress with our biological measures. We're also looking at physical activity, family relationships, and child behavior, as well as experiences of discrimination in the workplace, as well as identity and culture more at the individual level. As we move up to the home and neighborhood level, as a part of the research tech that's being developed by the team, they're deploying a home sensor that looks at air quality within the home and noise levels, as well as the phone app, which Carrie will talk a little bit more about, which gives opportunities to report environmental exposures outside the home as well. And then lastly, at the community level, we hope to assess the health impacts of social life, education, and occupational measures that tie into these individual health measures and help us connect them to the larger, more systemic issues that the whole community's whole health project hopes to build an evidence base that can contribute to changing these systemic level impacts. And then my last message for the cohort study is the important component of learning and response, with the key difference of information return occurring throughout the study versus after it's done, which creates a huge challenge, but also a crucial component of changing the way that science can impact people's lives and the way that people can impact science. Now, Carrie will go into a bit more detail about some of the research devices and finish out with descriptions of the mobile app, the HornSense app for the study.
So next slide. Perfect. So just to give you an idea, some of the tech that we've been trying to develop and test over the last couple of years to deploy as part of this study. One of the ideas is, of course, to work with the community to identify what are their questions they would like to have answered. So that's been a long process, but a really important one. The other kind of element that we're trying to do is to see if we can develop technology such that, and deploy technology, in some cases, off the shelf stuff, and other things, custom built stuff, so that we can collect the data more quickly. We can collect it in much greater amounts, higher quality data over longer periods of time in a way that does not burden the participants. Because remember, we have multiple types of measures that we're trying to investigate as part of this study. So just to give you an example of some of the research tech and devices, if you will, that we are deploying as part of our cohort study. The first one, I think folks can recognize the Fitbit up there, an activity tracker. And we've done several actually pilot tests investigating what kind of information can we get from these Fitbits, physical activity, heart rate. We've been looking at sleep quality, length, time of sleep, and then we're trying to link those across to different measures, for instance, to the home monitoring sensor, which is measuring, the indoor air quality in your home environment over an extended period of time, instead of, going in, measuring it for an hour and leaving, which is kind of the typical measurement approach. Can we do it in a way that is, of low burden, easy enough to do, and collect a significant data set in a short period of time. The other component, which is the second one listed here, is the smartphone app. We call that the HornSense app. This was or is being developed under Christine Julian and Edison Tomaz are leading this effort for Holcomb. And it's in partnership with the School of Nursing. And this is really kind of the glue, if you will, that holds these different monitoring technologies together. So not only can we collect data from participants, but we can also give that data back, as Sarah mentioned, to them in a timely manner such that they can use that to, better their lives, to understand what's going on with their home environment, for instance. So just as an example, the beacon, which was mentioned earlier, can do continuous indoor air quality monitoring in your home. We're also collecting dust samples that can tell us something about what different types of environmental exposures, allergens, mold, and other things that are developing in home environments. And as another example, not listed here, we can collect water samples because the community said we're concerned about the quality of our drinking water. So we can also collect, drinking water samples as well. So just briefly, I want to kind of hone in on the smartphone app and then do a shout out to Christine, who will be at one of the tables during the gather portion of this event. But we've developed or are developing a mobile app that allows the information, for instance, that's being collected on the activity monitor, if you look at the upper left there, that can tell you back on the app, oh, how many steps did I get in? How did I sleep? Oh, it looks like I didn't sleep very long and the sleep quality wasn't great. I didn't sleep very well, okay? It's also a way for us to collect data so you can self-report what you thought in terms of the sleep quality was that day. You can also, if you look in the lower left-hand corner, report, for instance, that one of the concerns that the community identified was odors. And so this allows the community members to report odor problems. And so, for instance, if you go to the right-hand side there, you'll see that the air quality survey, if there's a problem, an odor problem, et cetera, they can report, what type of odor it is and, what it's, if it's having an effect on their health. Then we also have the sensor dashboard. You see that in the second panel there, where we can pull in the pollen information that you get, the daily pollen, what the air quality looks like that day, just information that can tell you about your home environment, your health, and also maybe your outdoor environment in a way that you can use that to make your own decisions about your day. And to, for instance, if we find a pattern in odor in the odor mapping, for instance, then maybe we can use that to drive change and address those problems in the community. Next slide. So where we're at now, just to mirror what both Darla and Sarah said, we've launched our cohort study, and we're working with what we call ambassador families. And I call those the families that are willing to give us frank feedback on what they think is working and what isn't working. We're rolling out and formalizing this response plan, which you'll hear about, that was developed as part of the CST work, and you hear about that in a few minutes. Also family care plans, both short-term and to address short-term and long-term needs, and really figuring out how, with all these different types of data collection that we're planning to do, kind of in response to the community questions, how do we work out a schedule that works both for the researchers as well as, and more importantly, frankly, the families that we're working with. We want to make sure that not only are we collecting data they're interested in, but that we can give the information back in a way that they find valuable, and also spread out or pace out how we collect this data so it is not a burden at all on the families. And where are we headed? We're super excited about this Horn Sense, the mobile app release on both Google and Apple. And they've been working really hard with the School of Nursing to make that happen as well. And working on how we're going to, we get researcher data, it's in these units, concentrations of micrograms per cubic meter. How do I make that meaningful to a family? And how do we return that data to a family so it's valuable for them? And then really what we need to do is learn again, right? Learn more, continuously learn. And what that means is reflect, review, revise, basically get asking the ambassador families for feedback on what's working for them, what's not working for them, really what they would like to hear, what they want to learn more about as we move forward. And so first, I just want to do a shout out for all the ambassador families that are stepping up to help us, try this all out and make sure it's, working for them. And then also, you did the introductions. I think you should have reversed the introductions. Sarah Smith, Darla, Shireen, Esther, these are the folks that are really making things happen. So I just wanted to do a shout out to them. Next slide. And I think we're just at questions or comments. Do we have time, Shireen, or should we move on to the next one?
If we could actually hold those until after the next, if you have any questions, please feel free to add them to the chat. But is it okay, Dr. Kenny, if we do?
I think that's why I was suggesting yes. So that'd be great because I want to make sure Esther and Mia have time. So
that sounds great. Awesome. Thank you so much to both of you, Sarah and Carrie, for that presentation. As you can see, there's a heavy leaning, while it's not fully participatory action research, it draws on many different kind of community-based and participatory methods in terms of how we're implementing the studies. So that is definitely part of what we want to do with this. So I want to make a quick transition now so that you can learn a little bit more about a response plan developed by our community strategy team. And presenting on this plan today are Dr. Esther Calzada and Miss Mia Greer. Dr. Calzada is the Associate Dean for Equity and Inclusion and the Norma and Clay Lieben Professor in Child and Family Behavioral Health at the Steve Hicks School of Social Work. Dr. Calzada is a clinical and child psychologist with expertise in parenting and early childhood development. Her program of research aims to reduce racial and ethnic disparities in academic achievement, behavior problems, and socio-emotional problems. She serves as the faculty lead of the Community Strategy Teams for Community Strategies team, there we go, of Whole Communities Whole Health. And it is my pleasure to work with her on that. And so co-presenting with her is Miss Mia Greer. Miss Greer earned her Bachelor of Science in Nursing from the University of Alabama. She has over 20 years of nursing experience and 10 years of clinical laboratory management. She holds a CLIA certificate from the state of Texas. For 8 years, she has overseen and managed the operations side of ProLab, a national laboratory. And during this time, she played an integral role in the startup and operations of laboratories in 13 states. Mia works as the Chief Operating Officer of Community Coalition for Health. She is the Church Growth Minister for the Rock of Round Rock Church, and she is a member of the Texas Healthcare Association. And she is also currently serving her second year on Whole Communities Whole Health Community Strategy team. And it's a pleasure to introduce you to both of these wonderful women today to tell you a little bit more about the Community Response Plan.
Thank you, Shireen. And I really enjoy working as a community strategy team member. And one of the things that I want to say that I'm really proud of is this team is Whole Communities Whole Health is a real believer in something I'm a believer in is nothing about us without us. So this is what we did. We were able to do a study with the participants regarding all of the things that they needed or what they had issues with regarding their communities. You can go to the next slide. So one of the things we did is we had the families tell us what they need. We let the families be the experts as opposed to us eggheads being the experts for the family. So we asked them questions when it came to their physical health, their mental health, environmental, social, relationship, financial, everything that was about them. We asked their opinion. And instead of taking data and letting them go, and we go in and tell them what they need. So that was a wonderful experience. We also did a basic needs assessment conducted with all participants. Again, nothing about us without us. So they really came up with the response plan, and it was based on the needs that they told us about, and a collaboration with us and them as partners. We are strong in giving them the information to partner with where they're needed in where there needs partnership with the community members. Informational health sessions, we learned a lot, not only what their physical needs were, but also what their mental needs were, what their socioeconomic needs were, and even their environmental needs. They told us that themselves. And that has really brought a really good relationship and a trusting partnership by us allowing them to tell us instead of us coming in and telling them. You can go to the next slide.
I think the next slide is mine, Mia. So I am going to thank you and start by just expressing lots of appreciation for the community strategy team. This is a group of folks who come from all different sectors in the community who represent a lot of the perspectives that we as researchers don't always hold. Mia is one of those members. Quickly, I also saw Avi and Ive and Carol. So a shout out to everybody who is here from the community strategies team. Sorry if I missed anybody. So this team meets regularly to really just infuse that community perspective into what Whole Communities Whole Health is doing. And one of the kind of products that emerged from that is this response plan that Mia has started to talk about. And the response plan very much acknowledges some of the things that we've been hearing about. Mia was talking about the themes that have come up and what we've learned from the community already. But the response plan is actually a commitment to respond as we learn through the cohort study. So this is something that will be happening as the cohort study launches. And so the cohort study will enroll families, as you heard from Sarah and Carrie. And through that, we'll be getting lots of data on all of these different areas that Mia just covered quickly. And because we'll be learning so much about families, and because that information rightfully belongs to the folks who are sharing it with us. When they share about their physical health, when they share about their mental health, all of those, that information rightfully belongs to the folks who are sharing it. So our commitment is to find ways to, in very meaningful and useful and impactful ways, to address the needs that emerge when we do these assessments through the cohort study. And so Mia described that we have outlined some guidelines and some kind of action items as we learn about families through the cohort study. And one is just deference to families and really recognizing their expertise and knowing what they need and what's important to them. The second is a commitment to addressing any basic needs that come up in real time. The third is being proactive through these informational health sessions and really bringing community knowledge to the community in ways that are useful and really align with all of these themes that we're interested in that promote health and well-being. And then finally, we just want to make sure that those relationships with organizations and the community building is really happening. And so this is the part of the plan that we really think about as individualized per family that Mia discussed. But we also recognize that there are going to be community level issues. And when Sarah was talking about the cohort study, she showed kind of the nested ecological systems that families live in. And clearly families live within neighborhoods and, you know, they attend schools and these systems that are impacting them, and they impact more than just one family. So these are the community level issues that we know that we will be learning more about. We've heard a lot about them already, as Mia was describing. But as we move forward in the cohort study, then we recognize that certain themes will come up and that community level issues will emerge that we can identify and that we feel responsible for addressing. And so this community level response plan includes a procedure by which we will take all of that individual family data and kind of establish some metrics for recognizing when certain data are signaling a problem that's really more community-wide and not just isolated to a given family or even a handful of families. And once that issue is identified, then Whole Communities, Whole Health will convene a team to respond to that need. And that will be a collaborative effort that includes not only staff members and community strategy team members, but also folks from the community, leaders from organizations and other stakeholders. And then once that team is in place, then the idea is really to work together to understand the problem holistically, comprehensively, systemically, and then work to create and implement an action plan. And so a lot of this really is still kind of being worked out, but just to make that a little bit more concrete, this is kind of how we imagine this unfolding. The first is, as we're collecting data, Carrie was showing the mobile app, and maybe poor water quality emerges as something that we're seeing really come up for a lot of families in a given area. And so it raises to the level of a community level issue. It's not like we just need to work with one home on this issue, but now we know that it's a broader issue. So that's kind of the identification of the problem. And then from there, we really move to say, okay, well, what's happening, already around water quality? And that's kind of an assessment of the initiatives that are happening through other organizations in terms of local policy. And that's identifying those initiatives and also identifying the folks who are really working on that issue and bringing those folks together. And so they may be from nonprofit organizations, maybe from the water company, certainly from scholars within Whole Communities Whole Health who work on water quality, engaging with policymakers as well. And so once that team is created, then there would be planning around, well, what needs to happen next? And that might mean some more assessment to really more fully understand the issues related to water quality. It may be bringing in folks from the community to really work on, how do you organize and how do you advocate for better water quality? How do you campaign for that? Whatever that action plan is, then that's supported by the team and then seen through to a point of resolution. Now, Resolution is something that we say kind of, with lots of caution. We know that these are really deeply embedded systemic issues that are really complicated. And so our goal really is to move the needle on these and really start kind of to build some momentum in addressing these. And so our hope is to be able to contribute to the solution. So in this case, ideally, right, a water company would improve its water treatment methods to improve the water quality. But the solution may take lots of different forms depending on kind of all the folks involved and how much we're able to do. And so that's one way in which we kind of envision this community level response happening. And so
one of the things we need is for everyone here, or if you know friends and family, refer families to participate. We want to know what you want. We want to make sure that it's coming from you. If you have family in the area, if you have church members, if you go to the gym, remind them that you were at this conference and that they're participating in trying to help your community.
We also would love to just partner with you if we're not already, to have a really meaningful and effective community response plan requires lots of folks. And I imagine that folks on this call are the right folks who are really invested in the health and well-being of families in our communities, and who have different levels of expertise and perspectives to lend to these efforts. And so we'd love to connect with you and see how you can be part of these efforts with us.
Another way is to be a service provider who can take referrals for the people that we're working with, the families that we're working with. It takes a community, it takes all of us. And so if you have a service that you can offer, we will take it.
Absolutely. And if you're a researcher at UT, there are lots of opportunities to get involved if you're not already. The kind of scholarship behind all of this is part of what's driving it as much as the community. So it's really a marriage of those two things. So lots of different ways to connect with us on this, and we hope that you will. So we will stop there and turn it back to Shireen. Thank you.
Thank you.
Wonderful. Thank you both so much. That was, I think, a very informative presentation. So we're going to open it up now for questions, discussion, comments. So if you have a question for any of the presenters today, please feel free to you can either raise your hand, and when I call on you, you can ask the question yourself, or if you are more comfortable or aren't in a place where you can unmute, you can put your question in the chat, and I'll present it to the group. So either one of those ways is perfectly fine. But yes, thank you all to all the presenters today for some great presentations. And so while folks are thinking of a good question, I'll just go ahead and pose one to you guys. And anyone can take this. So how is Whole Communities Whole Health upholding community-based participatory practices? And what are you doing that makes you different from a typical academic research study? Who wants to take it?
I'll answer it from a CST perspective and a year in, going on my second year. I've worked a lot with people who want to go into different communities and get the information and extract it from the communities and don't want to put anything back into them. So with us being Community Coalition for Health being so boots on the ground type of an organization, we hear a lot of that where people get data fatigue and survey fatigue. But with this group, you can see that you're not just taking from the community and then taking it back to your school and just analyzing the people. You are taking the data that you've gotten and you're going to help the people with it. And that's what I love about being a part of Whole Communities Whole Health, is you don't leave the people behind after you get what you want from them.
Thank you, Mia. I appreciate your response. I think it's, for me, bi-directional learning, and the notion of I've learned just as much from the community as I have from my colleagues. And I have enjoyed that process. It has opened my mind to new ways of thinking, new ways of conducting research projects, and the importance of doing so. So the bi-directional nature and the ongoing edification and learning from partners about the community of which that, I'm part of the community as well, and coming to an understanding of that. So thank you, Mia.
Wonderful. Thank you, Dr. Castelli. So there's a question we have from Joshua Barbour. He says, thanks for these great talks. I had a question about the ongoing work with the community. Will they be connected in some way to talk about like shared experiences? Let's see. Joshua, I wonder if you can clarify a little bit about what connection you're referring to. Just to make sure we understand the question. Let's see. And then while we wait for your clarification, there's another question. Oh, sorry, there it is. So we'll stick with this one, sorry. So will they talk with each other as well as reporting that? So if I understand it correctly, will participants talk with each other is the question. All right, so Dr. Kinney or Dr. Castelli, would one of you like to take that one? Will participants communicate with each other?
Well, Josh, I think that's a great question, and something that we need to consider moving forward. Certainly there were focus groups opportunities and the coming together of individuals within the focus group opportunities. I think we have to be a little bit more intentful and purposeful in the coming together as we learn new things. And I think there's space for that to happen. I think we haven't thought through the exact processes yet. So thank you for your question.
Yeah, and I would agree. We've been thinking of this bidirectionality, but to your point, as you provide data back to the community, we have, individual data, that you can compare to, community data that's coming in. So there's the connection that way. But I think it would be really valuable as this cohort, develops, that they have the opportunity to talk to each other, because there is that ability then to directly share and grow together as a group and advocate for change in, for those that are interested in addressing one issue versus another. So I think that's actually a great comment, and one we should consider.
I'll also add that we actually had some focus groups over the fall where a lot of the current participants came from those focus groups, and they talked to each other there. And it was a very, they sometimes were saying, oh, that felt like therapy. And so I love that question about how can we continue to promote those connections between the participants, because they are all coming from a similar space. Thank you for that question, Joshua. There is another question. It says, I think they sent it directly to me. So this person is wondering if there is any plan for recruiting new faculties for Whole Communities, Whole Health. If yes, where can we find the opening positions? So that sounds like someone may be interested in joining the steering team. Would y'all like to talk about that?
So there's many different ways to get involved. We are actually sitting on quite a bit of data already that we were practicing. We tried to fail it quickly at home, which meant we did a lot of pilot studies within the UT community. And so we have quite a bit of data there. We're also going to be gathering quite a bit of data, in collaboration with the community. So there are many opportunities to partner with the researchers who are working on. We have task group leaders that are associated with each of the different topics, environmental, social and physical, physical and mental health, etc. So there's always those opportunities to join within those groups, to work within those groups, to work with either help with the data collection or with the data analysis. So yes, we're going to have more data than the number of researchers right now can handle, and we would love to have more folks within the research community that see, how this could, that like this model, want to work with the community, want to get feedback from the community, and provide their data back and information back to the community. So yes, there is certainly opportunities both in these task groups, because those are themed, or certainly within over time, as the steering committee, of course, those are also positions that have a certain rotation associated with them. All of that's been a little bit lengthened, frankly, because of the COVID-19 pandemic. We've been kind of sitting there, but let's just say there's so much going on right now. I'm not even sure how Sarah and everybody else and Shireen and everybody else is still standing, because we're, it's a beehive here. So there's many opportunities for a collaboration.
Thank you. So I'm going to quickly answer one last question that came up in the chat, and then we're actually going to wrap it up here. I know we didn't have a long time for questions and answers. This is a quick presentation period, but we're transitioning to gather, remember, so there'll be lots of opportunities to talk more and ask questions of everyone who's here. So I'm going to answer this one question. Ms. Anita Swayze asked, if a family lives within the Del Valle School District, would they be eligible to be an ambassador family? And the answer is yes, as long as they have a child 9 years old or younger. They were eligible to be an ambassador family if they live in that area, absolutely. And so I want to say thank you again to everyone, all of our presenters, all of you for coming and listening, and for the discussion. And like I said, if you have more questions, please bring them to gather. As Esther and Mia said at the end of their presentation, there are many ways to get involved if you're interested, or if you'd like to learn more information, whether you'd like us to present at your organization, if you work with families who are in this area, or if you want to collaborate with our community strategy team or on the research side of things, please contact Clint Laystaff, who is the program director of Whole Communities, Whole Health. I will put his information in the chat. But if you are interested in getting involved or you'd like to learn more, please contact